Good morning, everybody. My name is Chris Chia. I'm the moderator for the InMode Educational Live Stream Series. It's with great pleasure and a privilege to introduce Dr. Bruce Katz. We have Lisa Mettler, Wanda Cummings, Shannon Burge, and with Justin and Ryan behind the board and the cameras today. And I can't say enough, thank you so much for being here.
My pleasure, Chris. Absolutely.
Dr. Katz is a distinguished member of faculty at the Icahn School of Medicine at Sinai. And he's both a clinical professor and also the director of the laser and cosmetic clinic there. He's been responsible for literally hundreds and hundreds of international practicing physicians in aesthetics and dermatology, myself included, my partner too. We've known each other about 18 years now. And in addition, among his many accolades, he's a very sought out national personality for many syndicated and network programs, GMA, Today Show, etc. But from his clinical accolades go beyond just the quoting, speaking, editor for distinguished journals, and many other activities. But we really appreciate his Juva Spa. He's the founder and the director of the Juva Spa, which is a very well-known and super busy clinic here in the city, where he does not just affects excellent patient care, but he has tremendous volume. He's always committed to teaching and learning and for the betterment of technology, and no better person to actually introduce the 2021 season. So welcome, Bruce. Thank you so much.
Thank you, Chris. Very kind of you. I hope I can live up to those words.
I'm sure. Without further ado, we're going to just cut to our patient. We'd like to also thank our patients today. Without them, this would not be possible. All right, without further ado, Dr. Katz.
Great. Okay, well, now we're going to start with Morpheus8. This is the first procedure we're going to be doing. And this is really revolutionary technology. This is microneedling with radiofrequency. And compared to other devices, this goes deeper. It goes down to 7 millimeter depth. And we really see this become the workhorse device in our practice. We use it every day. It's really, truly effective. I think people have mixed feelings about microneedling RF. This technology really shows great results. We're really minimal downtime. It's colorblind, so you can treat any skin type. And really, patients come back asking for more treatment sometimes because they love the results so much.
Bruce, you're an expert in just about every technology that's out there. You've been at the forefront of all. Why RF now, and why would you say it's a cutting edge technology for the 2020s? Yeah.
Well, radio frequency I've found to be, first of all, colorblind, so it can treat any skin type. You don't have to worry about darker skin types, sometimes having problems with pigmentation issues. And by just doing microneedling alone, I think we found that the results were unimpressive, to be frank. By energizing those needles with radio frequency, not only do we go deeper to the skin, but we get expanded energy around the needles, so we get more improvement, not just in the exact area where the needles penetrate the skin.
Perfect. Also, depth of penetration is a huge thing, directing energy exactly where you want to do it. You can variable depth, etc.
Exactly. And there are a lot of different, variables you can adjust here aside from depth. You can change the power.
You can get a little tighter on the screen, Dr. Katz can explain some of those things.
So we have a number of different tips that we can use for Morpheus, depending on what area of the body we're working. With the face now, we're starting with a 24-pin tip. If we're working on a body, there's a new 40-pin tip. So you can really do a lot of areas very quickly. You don't have a small, pin here where it's just a small area you treat. So this allows us to treat larger areas, adjust the depth, which can go down to 7 millimeters. Energy-wise, I think we go up to 60 watts. We don't go that high, particularly on the face. And you can adjust the cycling based on how fast you want to be moving. So great variables to adjust, and it really gives us amazing results. I've been very impressed. Typically what we do beforehand is we apply a topical anesthesia, and what we found is that there's this new topical anesthesia called Prevadine. It's a 4% lidocaine solution, but because of the delivery system, it really creates incredible. We had done a small pilot study last year comparing it to BLT. We did one half of the face with BLT, one half with Prevadine. And we found that patients found this more comfortable.
Single agent.
Single agent.
Oh, it's a
compared to
delivery.
BLT. Yeah, it's a remarkable delivery system. What's also really great is that you don't have to wipe it off after. You just do 2 quick applications. It takes about 10 minutes to work, and then you just start the procedure. You know, it takes time to remove heavy creams, as we all know when we do a procedure. So if your nurse doesn't have to wipe it off and
spend 10 minutes doing that, that's a time saver. You know, in a busy practice, we want to be as efficient and time sensitive as possible. So it's a very nice liquid. Patients really love the results. Morning, Michelle.
Hi, Dr. Katz.
You know, I understand you have some concerns you wanted to discuss today. You want to start with your face first, and we can talk about that?
Yes, I'm concerned I have a lot of wrinkles. My pores look much bigger, and it's kind of saggy, my skin. So I was wondering, I heard about this treatment that you do, and I'm going to...
Great.
Yeah.
Well, let's take a look. If you can take off the mask for a moment. Let's see here. Yeah, I see you have a lot of fine lines over here and on your upper lip particularly, on the side as well. You're getting a little laxity here. Just turn this way, you're getting a little jowl here as well.
Yeah. My eyes,
around your eyes too. Yeah, I mean, this is quite common, and, you know, our patients really treated very well with Morpheus.
Okay.
Morpheus is a new technology. It's microneedling with radiofrequency. So we can not only use the radiofrequency to energize the needles, but we could adjust the depth. So it's really customizable to the changes in your skin. So we can go as deep as 7 millimeters, but also with the Morpheus, because of this new upgrade on it, we can do different depths, like say, for example, starting at 7 millimeters, going down to 5, and then down to 3 millimeters, all on one pulse. So it allows us to really treat people very quickly and very efficiently. And the great thing also about it is that it's colorblind, so we can treat any skin type. That's really important. And also minimal downtime. Most people walk out, they're just a little red for a day or so. You can certainly cover it with makeup. And obviously everyone's wearing masks, so it's really not noticeable at all.
Oh, that sounds great. It sounds good.
Any questions about that?
No, I really, that's you know, I'm sure that
we covered all the bases.
I'm concerned about. Yes, it
Great.
sounds good.
Okay, I understand you also wanted to talk about something on your abdomen?
Yes, also I was concerned, I'm not really exercising so much now because of we're all isolated.
Gyms are closed.
Yeah,
no,
so
sure,
I noticed
absolutely.
that my skin is sagging on my stomach and you know, getting a little puffy, and I was just wondering if there's something you can do for that.
Ah, okay. Let's just take a quick look. Great. Okay, great. So I see you have a little bit of fullness over here, a little bit of loose skin as well. And, you know, there are a number of different approaches, but I understand you don't want to do any surgery. Is that correct?
Yeah. Right. Yes.
So I think, you know, what would work very well for you is also a new technology. It's called Evolve Trim. And what it does is it basically targets the fat under your skin and melts it away. We also notice a little bit of tightening from the heat effect too. Most people need 4 or 5 treatments, sometimes 6 treatments. Again, no downtime. We haven't seen any side effects from it. And it's also, you know, colorblind, so we can treat any skin type. And I think you'll do very well. You just have a little bit there.
Okay.
And, you know, with probably 5 treatments, maybe 6, everyone comes in like once a week or so.
Okay.
And you'll get great results.
Oh, that sounds great too. Yeah. Yeah, and plus no surgery, so that...
Right, absolutely. You don't have the downtime from surgery, and, you know, it works really well.
Oh, that sounds good. Yeah, I
Great.
would like that.
Okay, so we'll set up an appointment for you, and we'll get it going.
Thank you.
And we can actually treat your face and your abdomen at the same time.
Oh, that's wonderful.
All right?
Yeah.
Great. Okay, so, you know, we're going to start with the Morpheus8 on Michelle's face. But I'd like to point out one thing. The great thing about this platform is that while I'm doing her face, we've connected the Morpheus, the Evolve Trim to her abdomen where she has a little excess fat. And we can basically do both together or one after the other. So this is really great technology. You can melt the fat with Evolve, you can tighten the skin, and you can tone muscles as well.
We'll show the audience that subsequently, but
Yeah.
the belt is on with 3 devices.
Exactly. Okay, so I'm going to start now.
Well, while you're starting there, Dr. Katz, I'm going to just mention that this will be available for our audience after viewing live in the InMode Resource Center that all InMode users have access to.
Great. That's very, very efficient, Chris. Excellent. So, important thing to remember when you're doing the treatment, you want about 50% overlap, going backwards and also side to side, going back this way, and also 50% overlap up, along the rows as well. Okay, Michelle, you're going to start now.
Foot switch activated, of course.
And I have it on repeat automatically, so I just keep my foot on the pedal and just move the hand piece so I don't have to keep stepping on the pedal each time, because your legs can get pretty tired doing that.
She's a nice trim patient with a good jawline. Some patients are a little heavier. Sometimes the skin kind of overhangs. Do you like to manually distract the soft tissue to make sure you have a good contact point? Good patch?
Absolutely.
Yeah.
That usually works quite nicely. A little distraction, they feel the discomfort already. And you can see we're going pretty deeply, 4 millimeters. We have 25 watts in terms of power, and Michelle is very comfortable.
So that's a very good clinical power rating. I mean, how do you obviously patients have different thresholds. What is your approach to that?
Well, usually we'll start at 20, 25 watts, and then as the patient can tolerate it, we will increase it. So Michelle's doing very well with this. I think 25 watts is good. I can actually increase it a little bit. So we'll go to 30 watts. Okay. And then you can see how deeply we're going. We're getting a little pinpoint bleeding here, which is quite good, because it tells us we are going really deep into the tissues with really minimal discomfort on her part.
We like to call that subcutaneous adipose remodeling.
Absolutely. Because this is really affecting, as you say, Chris, the fibroceptal network.
Exactly.
What depth is he working at?
4 millimeters.
4 millimeters. So that's good. So if I know it's colorblind, but darker patients tend to have thicker dermis. Do you adjust accordingly for depth?
We can, absolutely. I try to go for each treatment as deep as possible and with the highest energy as possible. Now, an important thing to remember also, with any microneedling RF device, you have to hold this against the skin firmly, because what can happen if you don't, it actually pushes, when you do the pulse, it actually pushes the tip of the handpiece away from the skin, and then you're not going to get the right amount of depth. So you want to hold it nice and firmly.
A little kickback.
Right, exactly. And you see I'm doing 50% overlap, side to side and above and below.
And what do you tell the patients afterwards in terms of what to expect?
Well, most people have a little redness. Again, depending on how deep we're going, they may have a little swelling. These little pinpoint areas will go away, in an hour, if not less.
Do you like to use a water-based moisturizing agent?
Exactly. You always want to be oil-free, water-based. That's all they really need to do. And obviously wear sunscreen if you're in a sunny climate.
So avoiding petrolatum-based ones is pretty important.
That's true, because we are making little holes in the skin, and we don't want people to start getting acne breakouts as a result.
How about HSV prophylaxis in patients with a history?
In our practice, if a patient has a history of herpes, we will basically prophylax them with valcyclovir, usually 500 milligrams twice a day for 5 days. I mean, there are other, ways you can do it also, but I've really never seen anyone have a flare of their herpes once we prophylax them.
We go to the overhead, please. Perfect, thank you.
How does that feel, Michelle?
Okay.
Pretty easy, right? Great.
She's a trooper.
You are.
Right.
And don't forget also, we could have had this running at the same time as I'm doing her face. So we could have been doing two different areas of the body simultaneously.
Yep.
That just shows you how great the technology is to allow us to do 2 different treatments at the same time.
Next, please.
So this is just a summary of what we were talking about, but it might be good to reinforce some of the points. What do you think, Bruce?
Yeah, no, I think a good point to remember also, Chris, is that though it goes to 4 millimeters, we're actually getting an additional 1 millimeter of peripheral spread of the energy. So it can really go down 5 millimeters on the face with only a 4 millimeter applicator. And we get nice uniform effect, no real thermal damage to the epidermis because we're going deeper to the epidermis. Tips are disposable. And we have a variety of different tips that you can use, a resurfacing tip, a 12 pin tip that works very nicely around the eyes.
Which you're going to do on the next patient, yeah.
Yeah, and then 24 pin tip like I just did on Michelle.
And next, please. And they're coated as well, so it's only a distal point of the tips. It's like it says, colorblind, and there's no ablation unless you're using the resurfacing tip. But for the Morpheus non-resurfacing, they're all coated and very protected.
Exactly, and that's a great thing. Having that resurfacing tip really allows us to go very superficially, particularly where people have that sort of crepey change in the skin, where you don't want to go deep. You want to be right on the surface and really take that away. But look, we have 4 different pin.
But we'll go into this. It's a busy slide. We'll just go right into the clinical aspect. And next, please. This just reinforces that idea.
Right, exactly. So you can see on the left the very superficial application of energy with the resurfacing tip, and obviously with Morpheus8 and Prime, the deeper penetration of the pins.
Right. Next, please. We'll go to the evolved Icahn. We'll go live, please, Ryan, into the body. So like Dr. Katz was saying, this is great. If you have multiple platforms, you can be real time saver, especially in an incredibly busy practice as yours. You want to, if you can do synchronous procedures, is that much more efficient. All right. So what we're looking at here is the Evolve device. And we're going to have, actually, Wanda, you're mic'd up? Oh, how about Shannon? Okay. Yeah.
Okay.
Wanda Cummings is going to give a little background on the Evolve.
So this is our trim. It is used, it's a short 15-minute procedure. It's using RF. It's a combination of suction, like suctions the soft tissue into the applicator. Excuse me. And then RF flows through to disrupt that fat cell. Very, very comfortable. At no, excuse me, at no point in time should this, thank you, Chris, should be uncomfortable.
It is very dry, wintertime in New York City.
Exactly.
Yes.
But I love it because it's like a George Foreman grill. You can kind of set it and forget it.
Absolutely, and and that's a very important point you raised, Chris, because in the middle of a pandemic, you don't want to have a technician working on you for half an hour.
Exactly.
This is hands-free. I mean, all 3 systems in this platform can allow us to do it all hands-free.
We call it a 2-touch procedure. You touch it twice on the application and a removal.
Right.
So
exactly.
It's a 2-touch procedure. And it's very safe for the patient and practitioner alike. And obviously, and your thoughts on the M8 and these other devices, you'll sub that out to your staff in many states. Obviously, that's state-specific, going to your Department of Health guidelines. But here in New York, physician extenders and even lower level certifications can
registered nurses can do it because it is, don't forget, it is radio frequency. It's not laser, which has more restrictions. And again, once you apply the applicators to the skin, we leave it alone, and patient can read their emails, they can listen to music, they can take a nap. I mean, it's really, again, very comfortable as well.
How do you feel? Michelle, how do you feel?
Very good, yeah.
Would you say temperature-wise, pain, or anything like that?
I felt a little pinchy in certain areas, but nothing like, a little more drastic. No, I just felt the needle or whatever it was.
No, I'm sorry, Michelle. We're speaking of your abdomen now.
Oh. No, I don't.
Obviously not. She didn't feel anything. Very comfortable, right?
Oh, it is getting a little warm, but.
Right. But tickly a little bit?
No.
Okay.
So here also, we should make the point that this is a 15-minute treatment, very quick treatment. Wanda, what wattage did you start on?
We started at power of 25,
Right? So 25
and we have our
watts.
temperature cut off at 41, and it is a 15-minute. It goes through a normal preheat session to get it to a certain temperature, then it begins to count our time.
Uh-huh.
The screenshot, please.
And how high can you actually go in terms of wattage?
It will go to 30.
It does. Oh,
It will go to
okay.
30.
So if the patient can tolerate that, that's great.
Very, right.
And most of the time, they don't need anything else but this. But you know, we have often patients who have variable pain thresholds, so we'll often add Pronox for those patients if they feel it's a little uncomfortable. But I could say 95% of our patients tolerate it without Pronox or any other analgesia.
Right. And if we look at the screen, you see, Dr. Katz, where it's like a FLIR imaging or thermal imaging, that we can look at it at any time and see that she's heating nice and even, and that she's at 39 degrees now, pretty much throughout. Very quickly, it's going to reach, when it gets to this point, it goes to 40 to 41.
Great. And again, 15 minutes, so it is very quick. No downtime as well. You just feel a little heat now, Michelle. That's basically it. And we're almost at maximum energy, so
Right.
that is quite impressive. Also here, we don't apply ultrasound gel because we need to have suction
Correct.
Right.
Correct.
against the
Dry.
skin, right?
Yep.
Correct.
And we like to separate the treatments by several weeks, and then probably, depending on the indication,
Right.
3 to 6
Right.
treatments.
Our protocol for all tight, tone, and trim is we recommend one treatment per week for 3 to 6 weeks for a series of treatments.
Exactly.
Yes.
I don't know if the audience can appreciate it, but you can see that the suction really appropriately pinching the soft tissues into the device so
Suction
you get
into-
maximum contact.
Right.
Great device, super simple. Wish there were more to talk about, but actually that's the beauty of it.
Yes.
Absolutely. And we
Exactly.
should also mention that this is bipolar radiofrequency, so we don't need to put a grounding pad
Right.
on her back, as you may have to do in other devices.
Great point.
Again, a lot easier with your staff getting right in there and starting the treatment.
Yeah, short couple episodes on Netflix and you're good to go.
Yes,
Correct.
indeed.
Well, Dr. Katz, we're going to cut away to our second patient, and we'll have Lisa Mettler, who's a PA and licensed here in the state, to apply the analgesia. She's going to talk about different modalities for M8 bursts, which she'll set up for you, and you'll get you all set up.
Great. Absolutely.
All right, so I have pre-infiltrated the lower part of her knee here, but I just wanted to demonstrate technique of what I'm doing as far as infiltrating with one with a spinal needle. It's a 22 gauge spinal needle, and then I also have the
Where's the trash?
mesocaine
Oh, there it is.
needles, both the 5-prong and the 3-prong. And these are available on mesocaine.com, and I typically get the 30 gauge 4 millimeter.
Do they come in 32 gauge
Or-
by any chance?
They don't.
Like the Botox? No.
Or I'll get the 30 gauge 6 millimeter. They have both. The solution that we're using is a dilute, it's actually Dr. Chia's solution A, which we can actually post.
It's a modified Klein solution.
A modified Klein.
It's basically 0.1%. It's 500 milligrams of 1% in 500 cc's, about 5 cc's of bicarb, and it's 0.75 mLs of 1 to 1,000 epi per 500 bag.
So all I did was put a little area of 1% width here for the insertion.
Jennifer.
And then the key is just to slowly infiltrate this area. The patient does have Pronox, but she's actually not using it. She's pretty comfortable. And the syringe that I'm using here is this syringe that self-fills. And this is from a company called CMS. And it basically just saves your hands. It makes it quite easy to infiltrate. So I'm going up to my marks here, slowly infiltrating deep to superficial, as Dr. Chia has taught me so many times. And this area will be completely numb so that we're able to do the Morpheus8Body at many different levels. So the last area I have here will infiltrate slowly.
Do you find it helpful to pre-treat with a topical for the just get the infiltrate in?
Usually I don't. I usually just use a little tiny bleb of 1% straight with epi, and that's really it. I mean, as long as your technique is slow and deliberate, it's actually really comfortable. Are you having much pain?
No.
Yeah.
That's great.
Yeah, so it's
rated
really-
distension is equal to stimulation.
It's really all about technique. So I feel like this area is infiltrated completely. I'm just going to get past my markings a little bit.
Ryan,
And-
if you could put patient D's pre-op video up, we can make some comments on that while Lisa continues her analgesic technique.
And then on the other leg, I'm going to switch over to the mesoram needles.
So this is her in a standing position. So I think she's in great shape, but she has some mild complaints of laxity of the anterior thigh, medial thigh, and suprapatellar skin, which is a large proportion of our patients that we see in the office in consultation. In the past, we couldn't really give them too many options, but I feel that this is a great adjunct. It's not going to be the be-all and end-all for someone with severe laxity, but a patient such as she, who's in good shape overall, good muscle tone, lean overall, but has a little bit of mild laxity, this is something that you can really benefit the patient in the appropriately chosen indications.
And we should also mention that in patients who have a good pain threshold, we could just use Pronox alone, and don't need to.
And just topical.
Injectable anesthesia.
Exactly.
So once Lisa gets her all done, we'll have Dr. Katz talk about the burst, which is exciting,
Absolutely.
exciting things. And I think Dr. Katz's office was the first on the block to get it before we even got it.
And I can tell you, it has really transformed our practice.
So what exactly is it for the audience, the burst between what you did with Michelle just a minute ago?
So the burst is really incredible technology because we can deliver energies at multiple depths in the skin with each pulse. So we can start with the 7 millimeter setting, and that will inject energy at 7 millimeters, at 5 millimeters, and at 3 millimeters sequentially in one pulse. So we're getting, instead of doing 3 passes at different levels, we're doing all 3 levels with 1 pass.
Incredibly efficient.
Indeed. And again, because we have peripheral spread of energy from the RF, we can go probably 8 millimeters at the lowest point, 7 millimeters being the setting, and again at 5 and 3, the same idea. So, and for that, again, we just use Pronox most of the time. Again, sometimes, as Lisa is doing here, people will have infusion of tumescent anesthesia. Okay, so watch the tip here. You'll see the needles come out, they shoot at 7, 5, and 3 millimeters, all just with 1 pulse. And you can see that is quite deep.
Yeah, it's quite deep. Excellent. So 753 currently, you can go 6, 4, 2, 5 and 3, and 4 and 2.
Exactly.
So you can customize the settings once again.
Yeah, and that will also determine the amount of downtime the person has. Again, what I mean by downtime is really minimal, but maybe a little more swelling, a little more redness. But usually within a day or 2, they're fine. Again, aftercare is basically just an oil-free moisturizer. That's all they need to do. And again, just in terms of indications, it's great for laxity, not just laxity, but also that crepey change we see on the skin surface, which is really hard to treat with any technology. And this does a great job.
Some of our colleagues would actually combine the resurfacing tip at the end or beginning before doing the deep M8.
That's a very good point, Chris. And with the
thoughts on that?
resurfacing tip, you really get it extremely superficially.
Yeah, for that crepiness you just alluded to. Yeah.
Again, when I'm using a 7mm tip, it's really important to make sure with each pulse it's not pushing the edge of the tip away from the skin. So you want to hold it nice and firmly so it actually gets down to that 7mm depth.
And the burst tip actually is separate. That's why the blue handpiece is important. The burst tip will not fit onto the black handle, 40-pin handle, as a safety feature.
Oh, yes.
So they're exclusive. I mean, we could do this, manually with the regular one, but it would take literally 3 times as long.
That's true. And also with this blue handpiece, you can use this on the Body Tight platform and the Optimus platform.
Yeah, Spiro and I would actually do M8 on certain areas on top of the Body Tight, such as axilla, inner thighs, arms, just as our go-to combo synergistic procedure. I think it's better than each one alone.
Oh, yeah.
So the complete platform is a good option.
Isn't that the Embrace approach?
Yes,
Embrace,
exactly, for
right?
face and neck. We actually extend it to the body as well.
Now, right.
Exactly. So correct. So Dr. Katz alluded to the bipolar, which we use a face tight and or AccuTight for small areas of face and neck, and then finish it with the combination Morpheus8 procedures. And that's we love it. Lisa, did you have burst slides to show? Maybe you can.
Yep, there's some burst
Dr.
slides you
Katz
can
can
pull
comment
up.
on those. Yeah.
Okay. I think we're just about
And you
done
can
here.
go full screen on those.
And you can see here also there's really no pinpoint bleeding like you saw in a face, obviously because the face is a lot more vascular than the thigh. But this is going 7mm without any pinpoint bleeding at all.
And she's not even taking her Pronox.
Yes.
So kudos to Lisa on her technique. So.
Okay, so the indications, obviously we touched upon that, but basically for wrinkling, loose skin, crepey changes, large pores on the face, if you're going to be doing it on the face. Again, we can go from 2 to 7mm depth, and it's all computerized. We just do the settings, and when we start the treatment, each needle size is 300 microns in diameter. So these are very, very fine needles. And that's also, I think, the reason why we don't get the pinpoint bleeding, because they're just so sharp and so narrow in terms of their diameter. And again, we are targeting the fibroceptal network in not just the dermis, but also in the fat layer, which I think you really need to do to get optimal tightening. We used to think that you target the dermis alone, and that would give us the best approach for skin tightening. But studies have shown that you really need to hit the fat layer because of the fibrous network around each adipocyte, and then in combination with affecting the dermis, you really optimize the cosmetic results. Contraindications, I mean, I don't think there are any aside from, a defibrillator, pacemaker, any implantable devices. That's the only contraindication. As Chris mentioned, if you're working on the face, we want to do a little prophylactic antiviral agents. And again, depending on the depth, you can use topical anesthesia. Here, that Previdine works very nicely on the body as well as the face. And just be careful when you're putting numbing around the eyes, obviously, so people don't get it in their eyes. And the Pronox system, which is just, again, a technology that really revolutionized our practice.
Yeah,
I imagine you found the same thing.
Yeah, you told me about that years ago, so we actually finally got ours. Yeah.
And you can really truly tell your patients that we can do any procedure now, from Botox, injectables, any superficial treatment, non-invasively, and in addition, even for minimally invasive procedures, we'll often, when we're doing smart lipo, we'll have the patients, suck on the Pronox tube while we're injecting the tumescent anesthesia, because that's really the only uncomfortable part. And they'll come back the next day or 2 days later and say, I didn't feel anything at all. They don't remember feeling any pain, but they were feeling pain. They just didn't care because they were having some Pronox. at the time.
Agree 100%. InMode Corporation has no affiliation with either Pronox or
Exactly,
Pronox.
and I have no
Just as-
financial interests
just to
as well.
make that clear. Thank you.
And again, also because this is radio frequency energy, you don't have to worry about putting shields in the eyes.
Yes, excellent point.
Obviously, you don't want to, particularly if the patient is a little skittish about it. You should not use metal shields. If they do want shields, you should use plastic for obvious reasons.
So what are your
that's
settings here?
So that's 2 passes at 2 millimeters at a level of 20.
And can you comment on the analgesia she received previously?
It was your topical formulation, which I believe is
BLT, yeah.
a BLT.
Benzocaine, touchcaine, lidocaine.
Yeah. So here's a pass at 20, 1 millimeters. Again, stretching the skin so you get good, tight coverage.
You can see the device deploying. You're doing a fixed or cycle?
Cycle so that the pins go in and out, and I'm doing it twice here.
You know, Lisa makes a very good point here because you always want to be stretching the skin wherever you're working, on the face or the body. Because if you think about it, if you have a wrinkle, and if you're not stretching the skin, you're only addressing the shoulders of the wrinkle and not the depth of the wrinkle. So you want to stretch it so that you get into the depth as well as the outer areas.
I think you'll have a better shot from the left side, but yeah, great.
Let me try this.
You just try not to block the camera. And can you come from below?
Sure.
Thank you. Great.
You can turn her head a little bit also. It'll be easier for you. Turn her head like that. That's it.
There you go. So again, starting at 2 millimeters.
How are you feeling, Chloe?
It's still a little intense.
Great patient also.
If it weren't, it wouldn't work. Right?
Exactly.
She's tough. New York tough, right?
Exactly.
Or is that Michigan tough?
Well, both. Actually, we're kindred spirits. Right? Us Michigan people, we know how to
It's true.
handle
You
pain,
gotta
right?
have a little bone.
So that's my pass at 2 millimeters. I'm going to do a pass at 1 millimeter, and then we'll move on to the other tips.
So Bruce, if they have like significant bags, which implies a septal weakness with some fat coming out, then
Sorry.
do you expect to get any fat lipolysis with this at that depth? It's relatively superficial.
Yeah, I don't think you're gonna get a
don't-
lot. I mean,
It's more
you
of a-
could if you were using a 7 millimeter applicator, but I don't think people could tolerate the discomfort.
Yes,
That
I
would be
agree.
very
Yeah.
uncomfortable. And it probably goes. You know, you want to be. I wouldn't use it on the face.
Right.
Obviously.
Just for purposes of talk about it, not we don't condone the officially the use of the burst mode of face, but there's some thought about that. What are your thoughts on that?
Well, I think, you know, theoretically, if you're using the 7 millimeter and you're using a burst mode, you will be able to melt some of the fat, particularly in the lower eyelid fat pads. That, I think, just makes sense. I mean, the energy will, you know, really affect the fat by just having a heat effect and destroying the cells.
Well, we bring that up because you have excellent clinical experience and you're looking into that. But as a general principle, we don't use the burst in the face.
Right.
Sean Paul, an oculoplastic surgeon and friend down in Austin, which we did last year series, uses the Accutite on the lids, and that is also available on the Resource Center. It's got a beautiful cadaver dissection and shows a real-time procedure. We actually may go visit him again in 2021 if we have
That's
time.
great.
Yeah. So
And that, you know, the Accutite system is great also because the electrode that goes under the skin is so small that you don't have to make incisions. It's like just injecting a needle, sticking a needle under the skin, so there are no incision marks at all. It's great. And you can do it anywhere on the face.
So now I've switched over to the regular Morpheus twit, the 24-pin tip, and I changed my settings. I'm currently around here at 3 millimeters, working at an energy of 25. And Chloe would really like this area tightened, so I'm doing double stacking, and I'm going to do a nice tight pass along here. And And then we'll also show an area, just for time's sake, I'll swap out to the resurfacing pin, and we'll do a small area of resurfacing, and then we can finish the rest of it off camera for time's sake. But this is more.
You can see Lisa's using the cycle mode, so she doesn't have to keep stepping on the pedal for each pulse, which makes it a lot easier for the doctor.
You guys are much more coordinated than I am. I can't do it. I always have to do it one by one also.
That's why we're doing it.
But Chris, you're a musician. You should be able to get that beat, that
But
rhythm.
you're a drummer.
Right.
I always try to play drums. I'm a horrible drummer. I get excited and the rhythm's off. Forget about it. But the take-home message is you can either use fixed or cycle depending on the rhythm of the practitioner and
Exactly.
But as you can see, that whole entire area has been covered. You shouldn't see skipped areas. You know, you'll know you're making a tight enough overlap if the area is very uniform. Do we have any other questions?
Oh. This is great. We have one more room to go to for the Evoke and Evolve. Actually, we'll do one more Evolve, and we're ready to go if Dr. Katz thinks it's a good time, because I think we'll just let Shannon and Lisa finish the treatments on our wonderful patients in here. And then why don't we show the video for patient J, please, Ryan? It's basically a 20-something-year-old woman with excellent skin. So we had the whole spectrum of age. And we're just going to use the Evolve. And then she doesn't need the Evoke, but we'll put the helmet on just for demonstration purposes in our other room over there once we run the video.
Yeah, she is a great candidate, absolutely.
Yep, exactly. So one might say, you know, she's got a very nice figure, but she actually would like some liposuction. But this, in the meanwhile, since she's readily available to have multiple treatments, I think she will start with this as a non-invasive procedure. I think she'll do great. She has good tone.
Yeah, and she can also use the Evolve trim on the sub-bra area, the mid-back where she has some bulging under the bra. That would be a great application also. Just take away that little fat bulge.
Okay. All right, well, I'm going to step over there and then I'll...
Do you want me to come also?
Yes, please.
Yeah. You're very organized, Chris. You got it all organized. Great.
We love having you. Great. So, okay. We just saw the video of Miss J here. Wanda's applying the Evoke just to her demonstration, but she's 20-something. She doesn't need it or request it.
30.
Oh, excuse me. You look like you're 22. Okay, she's 32. And she's got great skin tone. So, Wanda, if you can make some comments on that, please.
I'm sorry. So she is 32, but she has a little laxity in her lower abdomen that she doesn't like. No young 32-year-old likes. So we're using 4 of our tight across her lower abdomen. The tight is for skin tightening. Let me see. We have a capability of 8 of these applicators. Our energy is coming out of our middle positive electrode going to our 2 negative electrodes. But what's so great about this is that it is monitoring to the temperature 1,000 times per second. So according to InMode, to our ACE principle, we want to acquire, get to the temperature, control it, keep it at that 43 degrees for the extended amount of time we know to get those therapeutic changes.
And also, a great point about those 4 applicators, you can also be doing using the other 4 applicators on another part of the body simultaneously.
Absolutely.
Right?
I could have 2 on each arm.
Yeah.
Absolutely.
Yeah.
Or above the knees, which is another common area. So I'm setting my RF, my power. I'm going to take my temperature. The device will not allow you to go higher than 43 degrees.
It's going to breathe.
Oh. And my time. Typically for the tight, our treatment time is anywhere from 30 to 45 minutes. Okay. It's at no time should it be uncomfortable. It should completely be comfortable, Jennifer, for the entire session. And you'll see very quickly we will achieve the temperature.
What do we tell our patients afterwards, Wanda, what to expect when we're done in between treatments?
She might get a little red, but that's all. It will typically be resolved within 30 minutes. Now, we're going to do our tone, which is really exciting, our electrical muscle stimulation, immediately passed after this tight. We've gotten the muscles warm. Now we're going to stimulate them to contract. Now, sometimes after we do a treatment of tone for 20 to 30 minutes, they could have a little soreness, just like you had been doing crunches in the gym.
So we're spatially challenged in terms of real estate in our office. It's very tight. So we're actually in a consultation room, and we use regular furniture. It's a pull-out couch. You can do this pretty much anywhere in the office. We don't have as much space as Juva's, but we have a beautiful, huge office. So we had to make our rooms multi-modality, and this is a great thing because all these devices are solid state. They're on wheels. They're not too heavy. No mirrors or lasers to break, and it's very simple to move from room to room. As we did this morning, we have about 10 devices here. We're moving all around just fine.
You know, one thing we forgot to mention, which is really critical these days, is that there are no consumables with Evolve.
Right.
So
And Evoke.
Any of those 3 applications, none of them require consumables, and in this day and age, that's unusual. Most technologies come with consumables, so after you buy it, you still have a ongoing expense.
Yeah.
Really nice.
No chip card to purchase or any disposables.
Exactly.
Yeah, you can comment on the fit of the Evoke, please.
So also, even though Jennifer's only 32, she feels like she has a little sub-Q fat. She'd like a little tightening of that subdermal of her submental area. So we're at the same time we're doing our Evoke, which is also hands-free. Same technology as our tight, but we have it on her submental area. And Justin, if you could show us the screen, please. You'll see just as with the tight and the trim, we have a thermal image of our temperature. And you can see that quickly she has already achieved 41 to 42 degrees. So now that I put it on 41 because Jennifer was a little anxious. She'd never had the procedure done before. So I started at 41 so she could just get the feel of it. Jennifer, are you okay? You're good. So now I'm going to take her to 43, and I'm going to show you how fast she will achieve that temperature.
We put a little bit of topical on her, right?
On her abdomen, not on her submental. And she's
not really necessary.
so now she could sit, she could play on her phone. We just ask that they not speak during the procedure so that the applicator doesn't move or shift. With the tight and with the tone, we just use a thin layer of ultrasound gel. Now, what's so neat is that it alternates firing between the 2 electrodes. Okay, when it achieves temperature, you'll notice the gray line, it doesn't fire. Because when it reaches 43 and it's that electrode's turn to fire, it doesn't fire until the temperature drops below 43. That's our smart intelligence, monitoring that temperature 1,000 times per second.
And also the great thing there, Wanda, is that not only can you monitor the temperature and stop firing the RF when it hits the target temperature, each of those electrodes you can monitor to see that they're approaching that temperature.
Yes.
And also to make sure they haven't moved and are not in contact with the skin.
Absolutely, that's right, Dr. Katz, for sure.
Well, this has been incredible. What we'll do is we're going to step back for wide shot for our closing out. We'd like to thank Bruce again.
My pleasure.
Let's walk over.
Right.
Any discomfort, Jennifer?
Yes.
Okay.
You can take a nap. See, it's very comforting.
I'd like to remind the audience that all these live streams, including this one, will be on the InMode University resource website. And our awesome clinical staff are also available for any questions for our InMode colleagues that are using it.
Yes.
Dr. Katz, of course, is at Juva, the director over here in New York City. I know he's super busy, but I'm not going to put him on the spot and see if he's going to answer a call, but he's around. I don't think I got your cell number until recently. I know only 18 years. Just kidding.
Yeah. But you have on my email, so that's fine, right?
Yes.
Well, it's really been a pleasure, Chris. I mean, to organize this and have the right patients for the different technologies. I must commend you on running a great operation, and obviously you are on top of the latest.
No, it's a team effort, and the pleasure is ours, and I really appreciate it, Bruce.
My pleasure.
All the best.
Absolutely.
Thank you to our patients most of all, and our excellent InMode team and Brave Makers as well. Till next time, guys. Thank you.